Don't participate in sport during pregnancy. That was my topic. I'm going to spend a bit of time just breaking it down. Okay. So, exercise is not good for pregnancy. Remove this. Exercise is not good for pregnancy. So, it's important to note first and foremost that the woman's body goes through many anatomical and physiological changes, as we can see in this picture on the left here. The most obvious being the room the body makes to accommodate for the baby. The notion that exercise is not good for pregnancy is well and truly phasing out, as many healthcare professionals are actually prescribing and recommending exercise to the pregnant or expecting mother. The benefits of exercise during pregnancy. So according to ACOG 2002, page 79, exercise of 30 minutes or more at a moderate level every day of the week is safe for pregnant women to adopt. We've got a few benefits of exercise. The first one is maternal weight control. So women who exercise during their pregnancy are less likely to put on weight during their pregnancy and will often weigh less than a woman who doesn't exercise during their pregnancy. It's also very important for the pregnant woman to control and kind of prioritize her weight, because pregnancy weight is very hard to pre-pregnancy weight is very hard to regain once a baby's developed, and weight gain during pregnancy can also lead to the onset of creeping obesity, which is pretty much the small gain of weight over a long period of time. We don't want that. So maternal weight control is very important. Another benefit is thought to be the exercise helps prevent the onset of gestational diabetes mellitus, GDM. Benefits for the baby too. So some of the benefits for the baby can include the infant being born from an active mother will have a lower birth weight, an increased gestational age, and a lower body fat percentage, which is really interesting. Maternal fitness. Let's put this up here. Maternal fitness. So physical activity can improve strength. It can improve the sense of well-being. It can enhance sleep. It can decrease heart rate at rest and during activity. It can contribute to a leaner muscle mass, and it can also increase the stroke volume. And then we have the postpartum depression aspect. So it's thought that exercise can also help prevent the likeliness of postpartum depression, which a lot of women face after pregnancy, after the baby's been born, especially in twins, because there's two babies, especially if it's a first pregnancy too. It can be very overwhelming and emotional, and I guess anxiety can actually pop up. So exercise has got a few benefits. And these are some of the ones we've gone through. Things to avoid during pregnancy. So there's 3 photos here. The first one is a supine position. So as we can see, there's the wrong and the right. After the 3rd trimester, a lot of health professionals, doctors, nurses, sports scientists, physios, etc., recommend the mother not to lie in this position. It actually decreases the venous return, and this can decrease the cardiac output of the mother, so it's really just best to avoid it. Another one we have to avoid is exercise in a hot climate or a hot room, such as a sauna, which I think is the photo being used here. Another example would be you going to a spin class for 35 minutes and doing not just that, but high intensity in a hot climate. It's just going to increase the internal core for the mother's body, and that pretty much makes the baby cook in an oven, which is really not ideal. And we also have contact sports and sports that include height. So that's a no-brainer. As we can see in the image here, the basketballer looks like she's pregnant and she looks like she's going through a shot. Not only is that contact with the very close contact to her belly, but it's also a height issue. If she falls onto her belly or she falls, she could there's so many things she could do. She could snap her ankles, she could really badly hurt the baby. So it's a no-brainer to avoid those kind of things. Guidelines. So this is from Harrison et al. 2016 off page 29. And on the right-hand side, we have the lifestyle stages. So preconception, pregnancy, and postpartum. Then we have the factors to consider of each of those lifestyle stages. So in preconception, an increased weight gain in reproductive aged women is associated with the increased risk for cardiometabolic, psychological, and reproductive health risks, such as glucose intolerance, type 2 diabetes, the risk factor for CBD, and polycystic ovary syndrome, and their quality of life can actually be decreased, which is what we see in Figure 1 here at the top. Physical activity helps to prevent all the factors which are there, and for example, weight management and regular physical activity help prevent and treat infertility, according to the source of this figure. So move on to pregnancy now. Recommended examples of physical activity for pregnant women are walking, swimming, cycling. That's a few of the ones. They're low risk, they involve large muscle groups, and they can be kind of conducted in any environment. So there you can avoid the hot climate environment. Pardon me. It says in the big bubble here that 2.5 to 5 hours of moderate intensity activity, or 1.25 to 2.5 hours of vigorous activity is recommended per week for non-pregnant women. However, pregnant women are encouraged to do around about 20 to 30 minutes each week at moderate intensity. Try to do it every day of the week, but if they can't do it every day, at least 3 or 4 days a week, just to be active, really. I'll talk about preeclampsia for a little bit. So there was 2 studies, and they're contradicting each other. The first study found there was no beneficial role of physical activity in the prevention of preeclampsia in women who were at risk, or whether it be prior to or early in their pregnancy at the risk of preeclampsia, right? So this study included moderate intensity exercise at least 3 times a week for 30 to 45 minutes, either from 18 weeks gestation to 10 weeks, or from 34 weeks until birth. So those 10-week blocks. The second study found an inverse relationship between the increased physical activity before or during early pregnancy and the reduced risk of preeclampsia. So moving on to gestational weight growth, as we discussed in the previous slide, exercise has thought to prevent that. Weight gain, so not weight growth. Physical activity, which I find is really interesting, this topic, or this point, when it's used as an adjunctive treatment for GDM, so in alongside the treatment for GDM, it does show promising results due to its effects on the glucose uptake and utilization, but because there isn't enough evidence supporting this, it's really hard for a health professional to advise the type of frequency, the intensity, and the duration of exercise, plus, as I said, the type of exercise. So it's unknown because that's such a limited hasn't been researched much. Evidence suggests that women who participate in activity had a lower birth weight, had a lower risk of medical intervention during delivery, including C-sections. So they found that women who exercised were more likely to have a natural birth than a C-section. A C-section is really, we try to avoid that because it's a dangerous performance, and the recovery rate afterwards is quite high. Like, it's a 6-week break you can't do anything for. So most mothers try to avoid C-sections. Physical activity, regardless of the type and intensity, does not affect birth weight. Now that's contradicting what I said before from another source, so it's quite interesting to see that conflict of interest there. Postpartum, so we have moderate to vigorous physical activity does not affect breast milk composition and volume, provided the good nutrition was followed. And as we said before, physical activity can help improve depression, postpartum depression, and the factors that come with it, such as mood swings, self-efficacy, sleeping patterns. So that's a bit cool. And the last slide from Santos 2019, all these photos are from that book. We have types of physical activity. So as we can see in the images here, these exercises are considered safe and they are recommended by health professionals. So walking, jogging, cycling, swimming, water exercises, aerobics, Pilates, flexibility, resistance training. Low impact on the body, large muscle groups, and they're relatively easy. So that's my references, and that is me done. Thank you.